Hi, everybody. I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is Forbes contributor, Dr. Omer Awan. Dr. Awan, thank you for coming on once again.
Thank you so much for having me, Brittany.
I'm excited to break down some new news that came out this week. Research suggests that 19% more women's lives could be saved if they start getting mammograms at age 40 instead of age 50. This prompted the U.S. Preventive Services Task Force to recommend women start getting screened 10 years earlier. So what's your reaction to the news?
I think it's a great step forward. It's obviously something that we were hoping for a long time. We know that this is going to save a lot more lives. Breast cancer is very common. It's the most common cancer in women after skin cancer, and 9% of newly diagnosed breast cancers occur in women that are younger than 45. So, the transition of being screened earlier from 50 to 40 is certainly going to save a lot more lives.
That stat is very scary. How hard is breast cancer to both diagnose and treat?
It's hard, but mammography does a great job in detecting breast cancer, and it'll allow it to be seen in circumstances where it may not be clinically relevant. That's the whole purpose of screening, where we can detect a cancer before it becomes relevant, before you can even feel it in your breast. So very important for people to get screened earlier. And the reality is that breast cancer can be harder to diagnose in younger people, and it's often more aggressive in younger people. So it's very important for women with average risk of breast cancer to be screened at the age of 40.
Can you dive a little deeper into that? Is there a reason why it's both harder to diagnose and it's more aggressive in younger people?
Well, there are a lot of factors that are associated with breast cancer. We know that the most common risk factor is age, but genetics plays a big role. Whether you have certain mutations like BRCA1 and BRCA2, all those things can contribute to the diagnosis of breast cancer. And we know that 50% of women in America have dense breasts, and dense breasts are harder to detect on mammogram because the cancer is going to look very similar to normal dense breast tissue on a mammogram. So very hard to detect often in younger women.
I want to talk some more numbers here. Research shows breast cancer in women from the ages of 40 to 49 has increased annually around 2% from 2015 to 2019. Is there a reason for this jump?
Well, I think a lot of it has to just do with the fact that people are becoming more curious and people are getting screened, which is a great sign, right? Oftentimes, if people aren't getting screened, then they're not getting diagnosed with it, and hence it's not a statistic. So the fact that we're seeing more, can also be a positive sign, because that means we're detecting it more and we're able to treat it more effectively. But I think the bottom line is that people must go and get screened. And, really the fact that the screening age has come down to 40 is a great step, but really it should be annual. And the reason why I say that is that research shows that screening at the age of 40 annually will decrease deaths by 40%, as opposed to not getting screened at all. So, although the guidelines are a step in the right direction, I think we have a little bit more work to do to try to push for annual screening at the age of 40.
That's huge, bringing deaths down by 40%. And in your piece for Forbes, you said, yes, this is a great step in the right direction. We still have more work to do, a sentiment you just echoed now. And you also said that if there are annual screenings opposed to biennial screenings, there could be strides when it comes to health equity. Can you elaborate on that?
Absolutely. So, we could have a huge impact on health equity. Black women are 40 times more likely to die from breast cancer when compared to white women. That's a really scary number. And, just by decreasing or bringing down the screening age to 40 biannually, we're decreasing breast cancer death disparities by 57%. And if we do it annually, research shows that we may be able to decrease it by up to even 98%, essentially eliminating these disparities that exist between Black women and white women. So I think we have a huge opportunity to really promote health equity by, changing it to annual screening at the age of 40.
Those are huge numbers. Are there any other additional bonuses besides the health equity factor?
Well, I think we're just saving lives, and that's the most important thing, right? I mean, breast cancer, it's a huge burden here in the United States. Many people have breast cancer. 1 in 8 women will be diagnosed with breast cancer at some point in their life. So, the main factor, what we're trying to do is to save lives, decrease mortality, decrease deaths, and that's what's going to happen when we bring the age down to 40.
I mean, you say those numbers, that's just startling. 1 in 8. I mean, in your lifetime, the probability of you knowing multiple people who have breast cancer that's just a factor of life. But are there any downfalls when it comes to annual screenings?
Yeah, there are. And I think that the United States Preventive Services Task Force really has to juggle the pros and the cons and weigh the benefits and the harms to recommending earlier screening. One of which is, overdiagnosis and, having false positive results. A false positive result means that the screening test shows that there's a cancer when in fact there's not a cancer. And that can obviously result in anxiety. You can imagine, Brittany, going to get a mammogram and the doctor tells you that you have a cancer, but in fact you don't. And all the sleep that you're going to lose by hearing that, the worry, you contacting your loved ones, all that has a profound effect on your physical health, but also your mental health. So, they have to take that into consideration, and they have to look at the numbers very carefully and see, well, what is the sweet spot? What's the best age to recommend screening so that we can be most productive for our United States population?
I want to talk about the issue of false positives. When the COVID vaccine came out, there was an issue of false positives. Can you talk about that a little further? And should that affect when you schedule your mammogram?
Well, false positives are going to happen in any test, right? Because no test is perfect. The vaccine is not perfect. Mammograms are not perfect. But the bottom line is that we want to, from a public health perspective, diagnose as many cancers as we can to help people, to decrease deaths, to decrease anxiety. So I think the bottom line is that we have to encourage these screens with the knowledge that there will be times when the test won't do what it's supposed to do. And that is, diagnose a cancer when in fact a cancer does exist. All tests have false positives. Mammograms are no exception, but our goal is to try to advocate for mammograms with the lowest rate of false positives possible.
So right now the recommendation is age 40 to 74 every other year. Why does it stop at 74?
Yeah, that's a great question. And that's a question that the U.S. Preventive Services Task Force has to answer, because 20% of breast cancers are diagnosed in women that are older than the age of 75. And these guidelines don't give any recommendations for women who are older than 75. Your grandmother may be older than 75, and there are no recommendations as to when she should screen. So I think a little bit of guidance with that patient population would be very helpful, especially to relieve anxiety into some of those women.
The numbers we've been talking about today are truly eye-popping, and the task force said that breast cancer is both the second most common cancer and the second most common cause of cancer death for U.S. women. So knowing that, can people and should people get individually screened even earlier than 40 and after 74?
Definitely they can. So, it comes down to, getting a risk assessment and talking to your physician. So, the American College of Radiology and the Society of Breast Imaging recommend that all women, even by the age of 25, should get a risk assessment, because, you don't know what your genetics are. You don't know if you're predisposed. You don't know if you have average risk. All these recommendations are for women of average risk, but there are some women that may not know that they may have a high risk of getting breast cancer. So I think it comes down to, really just communicating with your doctor, having an honest conversation and figuring out what your risk is, so that potentially you may need to be screened earlier and you need to be screened for longer periods of time.
Dr. Omer Awan, thank you so much for joining me.
My pleasure. Thanks for having me, Brittany.